The participants?
Yes.
Tell Sally not to log on. This bunch guys should log on half an hour before 10.
Ladies and gentlemen, we would like to apologize for a small hitch, technical hitch, but we are back and I hope you are able to hear us. Straight away, my CEO will continue from where she had left.
So good morning again. I was talking about the areas we covered yesterday. As we shared yesterday, this masterclass, the first one for this year, is divided into 3 modules. The first one, within the main topic of emerging issues in labor relations, regulations, and legal instruments, is what we covered yesterday on the evolving nature of industrial relations. Today, we're looking at the impact of COVID-19 on the workplace, and tomorrow, we will be looking at significant trends in collective bargaining. Yesterday, there were a number of issues that were raised, which I was sharing at the point at which we got into the technical problem. Issues about social dialogue and how it functions within the labor relations process, how to manage redundancy processes, how to go about conversations on variation of contracts or management of contracts of service largely, in this era of COVID-19, how to renegotiate terms and conditions of service in collective bargaining agreements, and then the whole process of unionization, union recognition, the level of union representation. And these are issues that we plan to delve deeper into going forward. We are looking today at the impact of COVID-19 on the workplace. And at the end of the class, we hope to have given you practical tips in how to mitigate the impact of COVID-19 in workplaces. Of course, we know that the world of work has changed drastically. We continue to be affected by COVID-19 as we grapple with the third wave. Other than being a threat to public health, the economic and social disruption also threatens the long-term livelihoods and well-being of millions of Kenyans, and of course, the sustainability of enterprises. The figures that have been given by the WHO as at yesterday indicate that there are about 123,216,178 confirmed cases of coronavirus globally. And that, unfortunately, we've lost about 2.8 million people to this pandemic. Very drastic impacts on lives. So the global reduction in working hours has also been noted to stand at 8.8%. If you compare the fourth quarter of the year 2019 to last year, this is equivalent to 255 million full-time jobs. The Federation also conducted a study mid last year to establish the impact of the pandemic on enterprises. And we learned, we suspected it, but it was confirmed that enterprises were struggling with depressed cash flows, they were struggling with finances and overall operational issues, how to organize work in this new environment. The role of governments through the Ministry of Labor and Social Protection, the role of workers and that of employers through the Federation will continue to be crucial in combating the spread of the virus, ensuring the safety of individual employees, and also supporting the recovery of enterprises and their sustainability eventually, and also, of course, protection of jobs. So to have lead us in this important conversation today about the impact of the pandemic on enterprises is our Human Resource and Administration Manager, Grace Kaume, our Senior Industry Relations Officer, Moses Umbok, and also our Training and Consulting Manager, Eric Munyobi. I want to assure you that you're going to have a very informative and interactive session. Of course, it depends also on your participation. As Eric said, please feel free to post your questions and your comments in the chat box. And without further ado, it is now my pleasure to declare this second module for today officially open and to wish you a very interactive session. Thank you very much.
Thank you very much, Edie, for those wonderful remarks. So I'll pick up the conversation from where Edie has left it. And for today, we are discussing the impact of COVID-19 on our workplaces. It's been a year down the line, and especially for us in Kenya, since the first case of COVID-19 was confirmed. That was from March of 2020. And now we are looking back and seeing what impact that has had on our various workplaces since. So today, if we're to look at our learning outcomes for the session that we have, we expect that by the end of this session, the learners and all of us will have appreciation of the emerging trends of COVID-19 at the workplaces. What is it that is coming up and really impacting our workplaces, and given the challenge of COVID-19 and that we have to deal with in our workplaces today? Then we also need to appreciate the impact of COVID-19 on these workplaces and on industrial relations. because we know that industrial relations plays a key role in what we do in our HR work and in the relationships management at our workplace. So how has that been impacted? And further, we'd like to gain really some practical approaches and recommendations on what to do to deal with COVID-19 at our workplaces. So to get started, so this is the outline that we will have for today. We will look at really the context that we are operating in. We will look at the emerging trends and changes. We will have the impacts of on IR and the workplaces, recommendations, and lastly, we will look at a case study that will just help us to bring the case home and to really get some really practical issues and things that we can generally relate with on a day-to-day basis. Next. So I would like us to look at the context. And generally, in considering the context, many things have changed. And one of the things that has changed is really what our workplace is. And it's a very interesting debate, because we would like actually to see, what your comments are. We're asking ourselves, what comprises a workplace today? Because the workplace that we knew of, 2 years down the line, that definition is not the same today. We knew a workplace to be, a place where we go and we execute our day-to-day work. But really, today, workplace is anywhere. Someone told us that, they work even in their cars. People work, from the comfort of their sitting rooms or study rooms. What is a workplace today? And I don't know how you've been able to define that in the place where you're working or the company that you're working today, because that context has changed the whole discussion. And even as we look at the impact of COVID-19, then we're asking ourselves, which are these various spaces that are today comprising the workplace? We are looking at the current developments. We've talked about the third wave in Kenya. And at some point, we just see how that is really changing the whole perspective. But beyond it being a third wave, we're seeing new strains being reported. We're seeing new symptoms of the disease being reported, for example, diarrhea and vomiting. Some of these were not initially part of the symptoms that were indicated, but today we are seeing new symptoms being reported. What does this mean for businesses? That we could be having things, changing, or we could be having someone who is, struggling just with a symptom that we did not know of, and we have to keep track. This is changing. How is it impacting our economies? How is it impacting the labor market? But beyond this, how is it impacting the workplace that we live in? Because when these things happen at that global level, or when we watch news and we see, that there are these changes happening to the disease, then it means they have a direct impact on our workplaces and what we do on a day-to-day basis. I'm just saying that we're not out of the woods yet, because it's still early to say that we can measure the impact, the full impact of the disease. So at what point will we be ready to measure? Time will tell, but we can only progressively look at what is going on. So at a glance, and these are some numbers that have been shared even by our ED, we're seeing about 123 million cases globally, 3 million cases in Africa, and in Kenya, about 128,000 so far reported. Deaths have been on the rise, about 2.7 million deaths globally. In Kenya, we've already hit the 2,000 mark. That happened the day before yesterday. And really, it's a worrying trend. We have seen, however, a good trend in terms of recoveries, 69.8 million in terms of recoveries globally, and around 89.5 thousand in Kenya. What does this mean for us? It means that there are about 36,000 Kenyans who are still recovering from the disease. The question we ask ourselves is, where are these Kenyans? The thing to note is that these are not just numbers. When we say that there are 36,000 people who are still recovering at some stage, it means that these are our family members. These are our colleagues. These are people that we know. And now we are at a space where most of us at least can point out one or two people that they know have had to deal with this challenge of this disease, and unfortunately, some that have succumbed to it. The workplace is interesting because it is a place of infection. And we have to look at it with an interesting eye, because we have to look at ourselves as people who manage these workplaces and ask ourselves, how are we managing these workplace to ensure that we are not spreading, or people are not contracting this disease from the workplace that we are managing on a day-to-day basis? Are people accessing proper care? When you ask around whether the people that have contracted the disease have been able to access proper care, not everyone has. Some people actually have suffered to the very last minute without knowing whether or not they had the disease. How are we supporting the people in our workplaces to ensure that first, where they have suspicion of having contracted the disease, that is attended to, and then should they be confirmed, what kind of care they are getting? What kind of discussions are we having with our medical insurance companies to ensure that our staff are safe? These are the key discussions we need to ask ourselves as we progress with this discussion. And we've said it, really, this pandemic, it started as an unprecedented public health crisis. It then became a deep economic and social disruptor. It changed everything. All the economic projections that the economies of this world had were turned around, and things were not the same again. But closer home, it gave a toll to the labor market. And this happened in various ways. To the labor market, it has affected the quantity of jobs. And here we're talking about really the high levels of unemployment it has caused, and you've seen the numbers, and the levels of underemployment. Underemployment refers to, we have people who are utilized below their capacity. We have people, for example, who are only forced to work two weeks in a month, or people who are forced to work full-time, yes, but for a lesser pay. So the high levels of underemployment that we have today are really causing a big challenge to our labor markets. From an unemployment point of view, we have many people who have exited the colleges, even though virtually, in the last 1 year or so. So those people were supposed to enter the job market. And what has happened? There are no jobs created within the enterprises. And so those people are still at home, not forgetting that there's another bigger number that has been offloaded from the job market. And also what that is doing is it's really increasing the high levels of unemployment. And for people who are supposed to enter the job market, then it will take them a little longer to be able to get in. By the time the economies recover and employers start taking in more people, these people will have lost their time. And I don't know how long it will take for them to be able to catch up to where they were supposed to be. So really, this is a challenge that we will deal with for a longer period, of time. It also affects the kind of earnings they will have into the future. And that speaks to what you have next as a quality of work, because the wages are being affected. People are earning lesser than they should. There are people probably who are to get some increments that was not possible because of the crisis. So wages have been affected. And so we'll see a more depressed economy as we progress. Issues of social protection. When people lost jobs, then that also meant some of them lost the social protection aspect. NHIF, NSSF. So what that means is then we are more exposed, even as a people of this country. And it's really is a challenge that will outlive the pandemic itself. And then we have, of course, specific effects on the vulnerable groups that we have. When you talk of women, for example, they have been noted as really a group that has been more affected by the pandemic than other groups. So how will we ensure that we restore the balance for these vulnerable groups moving forward? So really a big challenge that we're dealing with. When we look at the impact of COVID-19 on the workplaces, then we're looking at it on many fronts. We are looking at it from the perspective of, we have to look at it from the perspective of employers, but also we have to look at it from the perspective of employees, because both parties have been affected. We have to look at the positive challenges or the positive impact of the pandemic, but also the negative aspect, because the pandemic has brought both positives and negatives. Then you also have to look at the short-term challenges versus the long-term challenges or opportunities that the pandemic has brought. So it is really the nature of the impact of COVID-19 is multifaceted. It takes many shapes. It takes many faces to it. It is very complex, but also still in progression, to the point that we can only keep monitoring what is happening on a day-to-day basis. And it is very difficult to say at this point, we have arrived, because we are still actually in a worse off situation in terms of really the numbers that we are seeing compared to even what we've gone through already. So if we go to the next slide, I'd like us to take a global outlook of this. And sometimes last year in July of 2020, the ILO organized a global summit that they deemed Building Back Better. And this summit underpinned the need for renewed vigor and really to face the crisis, because we have to be strong enough to be able to fight the pandemic and to face really the challenges that have been brought about by this. The conference also underpinned the need for a human-centered approach to the crisis, because this crisis has affected human beings. So how do we ensure that we retain that human face even as we deal with the pandemic? There is need for the enterprises to recover and to be supported to recover. And then the need to utilize the opportunities that have been provided by COVID-19 to build back better or to come out stronger. And this does not only apply at a global level, it also applies to us as at our enterprise level. To what extent are we utilizing a human-centered approach in dealing with the challenges that we have to deal with at the workplace? But further, how are we utilizing the opportunities to come out better as an enterprise? Generally, the economies really have reported a negative growth. Productivity levels at the enterprises have gone down, have declined. Some markets have shrunk. So supply chains have been affected. People have goods, but they have nowhere to sell them to, or they have no connection between where the goods have been manufactured to where they are needed. Then there are big inequalities that are really growing, and that gap of inequality is growing, where the poor keep getting poorer. And of course, SMEs have been worst hit. But the pandemic has also brought in some really great opportunities. Some industries have fundamentally accelerated or grown. We have seen some trends, and really what we'd like to talk about here is like the future of work. And this was discussed for a long time as a concept that was far off, but it's really been brought to the fore. And in 2019, when there was that declaration about the future of work, and FKE played a key role in that, you find that some of those things actually that probably people thought would come so many years later are now here with us. And then of course, there are some opportunities for some novel industries. We've seen the ICT companies and other very innovative companies coming out quite strong at this time and taking advantage of the moment and driving. So will you watch our companies go down, or we take advantage of the opportunities to grow and come out better? The FKE survey has been mentioned, and some of the key things we'd like to highlight is the cash flow and the financial challenges that really businesses reported in addition to the supply chains of the businesses. And really what was sad is that COVID-19 had wiped out 8.3 of the employment in the formal sector between March and July of 2020. And that's really, our analysis showed that 80% of the jobs that had been created since 2015 had already been wiped out. And this was only up to July of 2020. What does this mean? Is that it's a worse off situation right now. It's a situation that is likely to take us back, even 10 years, back really as an economy in terms of the number of jobs that we have created. This is in the formal sector. The informal sector takes a bigger chunk of the employment in this country. So that's a worse off situation. So really you can be able to put that into context. And then more than half of the private sector enterprises did not have enough resources to meet their staff costs in the next 6 months. This was July, and we are already in that 6 months since July. So we're asking ourselves, what does this mean for jobs this year? Is it actually likely to show, are we likely to see a trend of more layoffs now that companies had already said they will not have resources to sustain the staffing costs? And so what to do at such a time? Is this the time to put in some measures that really will ensure that the cash flows are enough to sustain our costs? Then 2/3 of the formal sector enterprises really require high labor costs and an employment and an entitlement. Basically, these are the costs that are really more of fixed costs, and you have to incur them whether you're in business or not. I would like us to look at this picture. I hope it's clear. It's a picture that I got from the newspaper, the Nation newspaper yesterday, actually. It was page 23, 20-something of the Daily Nation yesterday. And it just painted a picture of a year, a pandemic year in numbers. And basically what this report says is that really 5.7, we had a 5.7 percentage fall in our GDP. We had reported 1.7 million loss of jobs in this country. And really, if you look at the people who are in employment, a year down the line, these numbers are getting worse. It speaks of some good news that yes, now at least there's a vaccine in place, and we already have people that have been vaccinated. It was saying about 9,000 health workers had so far been vaccinated as of yesterday. But also it painted a picture that most of the people that have contracted this disease either were asymptomatic patients or were patients with very mild symptoms. What does that mean for us at our workplaces? It means just really the need to be vigilant and not to take anything by chance, because about more than 50% of the people that were confirmed with the disease really did not show very severe symptoms, but that still meant that they could spread the disease. So they need to be really very, very vigilant. So really the picture is not as good. There are very, some sectors that of course were hardest hit: the export processing zone, the aviations, the horticulture, tourism, and hotels. And this is where some of our businesses lie. And even if this is not where they lie, they either are the consumers of our products or we get something from them. So in essence, the whole economy is affected. Next. So now I'd like us to look at really some of the emerging trends in our workplaces and some of the changes that we have had to make in our workplaces. And I would like us to look at it from various facets. We will look at it from a strategic perspective, from a labor administration perspective, structural, financial, technological, and social perspective. So from a strategic perspective, the same slide, sorry. So from a strategic perspective, we have had to make changes in terms of our business models, or rather companies have had to change their business models. And as we look at this, I would like us to really reflect and ask ourselves what we have done for each of these facets in our various businesses. Some business models could no longer work as they were initially. And so people had to go back and probably redo their strategic plans and decide what they want to focus on and how they would like to deliver. People have had to change their policies to respond to the needs of the business, because some policies were redundant or were declared redundant by the pandemic, or were not responsive enough to the demands that were posed by the pandemic. So that becomes a key issue that we look at from our workplace perspective, and that we have to ask ourselves, even as we continue with this, what change have we made? There are issues around investment decisions from a strategic perspective, because companies make decisions on where to put in the money and where to invest. So from a strategic perspective, investment decisions then become very key. Who is driving what kind of investments we are making as a business? Are we likely to invest in investments that will give us return for our investments or for our money? Or are we investing in places where we are not likely to get positive returns? And that goes in many fronts, and I would like to keep on bringing also the HR angle to it. For example, where is our money, that goes to pension where is that money being invested? Is it being invested in the right places? Are we checking where our investments are going? Or are we likely to invest, resources that have been earned over time to vehicles that are not likely to give us the proper returns? So that need to exercise caution as we go along becomes very critical. The other component under strategic is the issue of course, innovation. And innovation, I'd like to look at it from what we call the 4 Ps of marketing, if I was to borrow from the marketing field, that talks about really the need to innovate the kind of products that we have. How innovative are they? How responsive are they to the needs of the market? They need to look at our pricing models. If now we have to offer virtual masterclasses like what we are doing now, as opposed to what we are doing initially, which were physical classes, then how innovative are we in terms of the pricing models? Because that will determine the extent to which we remain in business, and that cuts across all businesses. The need to determine the kind of where we place our products. Where are we selling our products today? Do we have teams within our companies that are looking at the relevance of our placement models? And then how are we promoting our products? What kind of advertising mechanisms are we putting in place? And is that working for us? Because if it is virtual, then we need to have certain drivers to that. Are we going more of digital spaces? Or are we stuck to old ways that are not working? Remember, the key thing for us is the enterprise must survive. And so even as the drivers of people aspect, we have to ask ourselves and ask our businesses the right questions around the strategic components, whether they're being addressed, because that's what drives the businesses that we are in. The next thing under labor administration is around really how work is done and where work is done. What kind of what shapes are we taking? What is taking shape in that kind of space? Are we stuck to the old ways, or are we open to try new ways of doing things? How are we measuring results? How is supervision being offered? Because traditionally managers have managed people by being around, but this is different. So it speaks to the kind of systems and structures that we are putting in place to be able to measure results as opposed to presentism. We are looking at issues around the structures that we have to put in place. And these structures look at, for example, our needs for physical space. How much space do we need? Maybe right now we actually need lesser space. And there was an article again in the newspaper yesterday, I think Business Daily, that was talking about really the way many companies, of course, have resorted to lesser space. But you find that in places where there has been big spaces like malls where there are what you call anchor tenants like supermarkets and all that, and now they have left, what's happening is that the new trend is now more of stalls, which are smaller in size, because many people who lost jobs went to start some businesses. And that same newspaper highlighted the increase in the number of businesses that were reported to be registered last year. So many of the people who lost employment tried to go into business, so they registered businesses and are taking up small stalls. So as opposed to a big mall that could be occupied, say, by our old Tuskies, then you find it's subdivided into very small stalls. And that's the current trend that we are seeing. So that also speaks to our needs in terms of structure. What kind of facilities do we need and how do we organize them? Issues of social distancing, of course, must be provided for. And the key one around structures is around the OSH provisions, really. And this speaks to the sanitation facilities that we have to provide. Have we done enough as enterprises to ensure that those facilities are provided and to the required numbers. Those are changes that people have had to make in those. Then technologically, the pandemic has forced companies to look at investments, of course, in terms of ICT, to be able to accommodate alternative working arrangements. We're calling them alternative working arrangements, knowing that, for example, the biggest one, or the one that has a buzz right now, is working from home. But alternative working arrangements are bigger because they are beyond working from home. It's, even, you could work from anywhere, not necessarily from home. It's remote working and other forms of working. And yesterday we even had a mention of the people who are really venturing into the gig economy and all that. So what investments are we making to promote even collaboration, where 5 or so people can work on the same document at the same time from their various locations? The issue of the future of work we talked about, and then key also is the connectivity internally and externally. You find that most of the meetings internally within your company, or even with other entities, even with us today or globally, really are being done online. So if your company has not been able to get to that level, then it is a challenge, because your people will be left behind. So that needs to be an investment that really is fast-tracked, because we are not likely to find ourselves going back. If anything, things will advance more towards this direction. From a financial perspective, cost containment then becomes very key. What measures are we putting in place? It could be from the big things to the small things that we do. How do we manage our costs to ensure that we are not outdoing ourselves in view of the kind of income that is coming in? Last year, people put in measures like pay cuts and all that. Is it sustainable? To what extent? Those are the challenges and the questions to ask ourselves. But beyond salaries, there are costs, like on our day-to-day consumables, on our electricity and all that. To what extent are we managing that? Because there is a direct impact to the bigger cost matrix. Investment decisions, I talked about that already. Then from a social perspective, and really from a psychosocial perspective, we're looking at a really disrupted sense of community within our workplaces. We are Africans, and there are certain norms that we are used to. People, loved handshaking and all that. That's not possible anymore. So how then are we promoting people, ensuring that people can still have that sense of community, but while observing the guidelines that have been provided? Are we providing for opportunities for virtual communication, for virtual catch-ups, for people, even the managers, to check on their teams every so often, but even when they are away? And then the biggest issue right now becomes then the mental health issues that companies are having to deal with. And we've checked with medical service providers, and for sure, there's been an upsurge of the numbers of mental health cases that have been reported since last year, since the beginning of the pandemic. And some people have resorted to even, suicide, among other things. We've seen some things in the media which you cannot really explain why someone would kill a whole family of, 4 or 5 people. So there's a huge rise of mental health challenges, issues of stress and depression. And when we talk about these things, then we have to bring them closer home, because these are our employees. These are, the family members of our employees. So how are we helping our employees deal with that challenge on a day-to-day basis? Are we providing referral mechanisms? Are we providing a service where they could reach out to a counselor? Are we even, as HR people ourselves, available to be reached out, or to provide some counseling within our workplaces? So really, we have to think about all these 6 facets and make sure that they are running hand in hand. Further, looking at the impact of the pandemic, from then the front of both the employers, or rather the enterprises, as well as the employees, we are seeing a lot being reported. From an employer's perspective, we are seeing really an increase in cost of doing business. It's not been easy, because you find a good example is, say, for example, the people who are in the transport sector. And you have these buses that have to run. Say a bus has to leave Nairobi to go to Eldoret every other day. The fuel that it consumes is, the same number of liters that it was consuming when it was being filled at full capacity. But now you only have to do like half the capacity. To make it worse, the cost of fuel has gone up. And you still have to pay that driver. So really the cost of doing business is increasing by the day. The returns on the other side are dipping. The profits that we are getting, the income that we are getting from these businesses has been on the decline. The reduced productivity levels, if you cannot, in that hotel, keep, you cannot operate 24 hours because you have to close by the curfew hours. What that means is that really your productivity level as a company or as a hotel cannot be at the same rate that it was when you are doing full capacity. So how do you manage all that? It's a big challenge. Issues of employee engagement are very key. I mean, how do you keep people engaged or motivated when they're still at home? And as we think through them, these are some of the things that we need to draw strategies for as we progress, because there are things that, again, we've said will live with us for a long time, because people are away, they are away from your eyes. You can't tell when they are happy, when they are not happy, because you're interacting via gadgets, it's via laptop or phone calls. How do you ensure that they're constantly engaged? We've also seen people who have stepped out and now they are doing 3-4 other things. So how much time do they give to your work? And what structures have you put in place to ensure that your system is performance oriented, is really productivity based, as opposed to I logged in, I was available online throughout the day with no tangible results. To what extent then will also, this pandemic, it has also affected our turnover, our staff turnover, some of it involuntary, so to speak, because when you lay off people, even if it's not your fault, unfortunately, that speaks to your staff turnover numbers. So that has had a big dip on the companies in terms of the numbers that they're recording, or the percentages they're recording in terms of staff turnover. It has resulted to gender imbalances. We talked about it earlier, and quite a number of research studies have shown that women were more affected. So if it ended up that most of the women were offloaded from the job market, then it means that our balance or our proportions in terms of gender, our staff proportions have been kind of thrown off balance. So how long will it take for us to restore the proper numbers, at least that meet the gender rules? Then issues of course, a lot of uncertainty around businesses. What will be happening 2-3 months down the line? We do not know. From an employee's perspective, some felt there was, of course, flexibility and control. They were now at home. They could have time with their families. They could control what time they deliver results. And that was a good thing. Work balance was affected in different ways for different people, because some cited that they were now at home, they could be able to spend time with their families at the same time they live on their work. So that was a great thing that they celebrated. But at the same time, we've seen cases of what we're calling blurred lines between work and life, where someone, yes, is working at home, but there is no limit of what time you're working, what time you are with your family. It's any time is working time. So you find some managers, for example, are still sending you work, at 8 p.m., 9 p.m. Some people have to stretch over some hours to complete assignments. No one can see your stress levels. So it's just work and get it done. So we've seen those two kind of scenarios being reported in as far as work-life balance is concerned. And so for us as structural decision makers is to ask ourselves, to what extent then are we really helping people still live their lives when delivering on this work without distorting their lives in general? Of course, some incomes have been lost and jobs lost. People have had to reorganize themselves. Issues of stress, we've talked about, depressions, and really relationships that have been affected. And last year, even cases of domestic violence were really reported. And my key message is to keep reminding us that when we see those things being reported in the media, they are not just numbers. These are things that are connected to us in one way or the other, because these people who are going through domestic violence could be the same people that we have in our workplaces, could be our colleagues, it could be their family members. So if someone has had these cases of domestic violence where they were working and you're expecting them to deliver at the same level that they were delivering, and possibly you don't even know, how best do you support them? So really it calls for a lot of openness in the way we approach our businesses. Of course, lots of uncertainty and loss of security, and really feeling of increased vulnerability, people fearing to lose their jobs anytime. Next, I would like to look at really the impact of this pandemic on IR in general. And what we are seeing today is that we are getting increased new grievances, some grievances or complaints that were not there before, and some new disciplinary measures that are coming through. For example, we've seen people asking cases around, I've had an employee who was arrested during curfew hours for failing to observe the guidelines that have been given by the government. How do we go about disciplinary cases in such a scenario? So these are new, or rather emerging new disciplinary issues that we're experiencing in our workplaces today. And so it means we've got to think broadly, look at even the kind of policies we have, and see then to what extent they provide for guidelines that are provided, by the government even at such a time. We are seeing non-traditional ways of handling grievances and disciplinary measures, things like virtual hearings for disciplinary measures, for example. We are seeing online dispute resolution mechanisms, through what's called the ADR, alternative dispute resolution mechanisms, being carried out virtually or online. So to what extent have we embraced some of these, or to what extent are we preparing ourselves for some of these, because they will be here with us to stay for a while? We're seeing cases of, again, from an IR perspective, delayed or suspended implementation of CBAs or some clauses thereof. So we talked yesterday extensively about the MOU that was signed through and by the social partners. So some of the recommendations there were around suspension of CBAs or some clauses, and that happened, yes. But we are seeing that is really affecting. So we're seeing now with the unions, starting to push, to make a push on some of those clauses that were suspended. The new challenges are coming up. We've got to determine how to handle them as we move forward. We are seeing cases of course, force majeure or inability to execute contracts. And then we are seeing dialogue then becoming very critical. Yesterday we talked again extensively around the issue of social dialogue on issues of salary cuts or reduced working hours or reduced work or having to work in shifts. So then at such a time, you're seeing social dialogue becoming very critical in handling these matters. And moving forward, then we are seeing there will be consideration for new clauses in either our future agreements or in contracts or in CBAs, like what you've talked about, the force majeure. If for any reason you're unable to execute your contract because of factors that are beyond you, then this clause would come in handy. And this also touches to the kind of contracts should be considered and have them in our employment contracts as employers moving forward. That's a discussion we are seeing. And the same thing also for CBAs, because you see right now, most CBAs do not have such clauses. So to what extent can an employer cover themselves if, in an extent that they are not able to execute the agreement that they have had within the CBAs. So in the next slide, then I would like to provide some recommendations before I give a chance to my colleague Moses to come in and just help us with the next part of this training. So I'd like us to look at then the key things. What is it that we need to do? And the first thing we're saying is that health and safety still remains a key priority, and OSH cannot be overemphasized. Remember first, this is a health crisis. And so we've got to give solutions to the health challenges. So our health and safety kind of standards have got to be up there. What kind of guidelines do we have in our workplaces? What kind of structures, what kind of sanitation places have we put in place? Do we have our OSH committees? Are they active? Are they trained? Are they well equipped? Do they know what to do? Are they doing their audits? That becomes the biggest priority for this pandemic and moving forward. And if we were to make any sacrifice, then health and safety should not be the sacrifice that we make in our workplaces. It should be the one thing that we guard and guard so closely that even if we lost out on anything else, we should not lose on that. So for us, we are emphasizing that let's really give a key focus on our health and safety standards. Let's go back even and look at our OSH guidelines, OSH policies that we have. Do they require some revision? And if so, let's do that. And let's not assume that we did it last year and so now we can take a break. In fact, if anything, this is the time to pick that up again and ensure that it is at its really topmost. And health and safety today looks at even things like, things like the protective gears, or the extent to which, are people wearing their masks? Are they sanitizing the right way? Are they washing their hands? Just really being able to emphasize some of those things and ensure that people do them and in the right way. We need to rethink and be innovative. We have to look at cost-effective, cost-appropriate, and sustainable ways of doing business. For whichever role that we play in our businesses, we have to remember that at the end of the day, we contribute to the bottom line. So how cost-effective or cost-appropriate are our initiatives? Even when we come up with these big initiatives and say, this is what we want to do this year, are they sustainable? Are they appropriate? Are they forward-thinking? Are they forward-looking? And how, if we were to do those things and the pandemic continued in the same pace that it is at today, will we still be in business a year down the line? So those are some of the questions we need to ask ourselves for whatever initiative that we are putting in, so that if it's something that is likely to propel our business to the next level, then by all means we should do it and go forward with it. But if it, for any reason, it's likely to take us down to a dip, then we better be conscious and do that which is likely to assure us of sustainability. We need to review our institutional policies and guidelines for relevance. And this cuts across all policies that we have. It's not just the HR policies, it's also even our finance policies, it's our risk frameworks, it is, we've talked about OSH, it's our procurement processes, it's everything that we have in our organization. To what extent are they relevant and responsive to the challenges that we have seen that have been brought about by the pandemic? We need to check on our employee wellness programs. I think I've talked a lot about that because we should not lose the fact that we are dealing with human beings. And so the fact that these are humans, these are people with emotions, and these are people who could be suffering, even some in silence. And so we should have initiatives that really take that into account. And then to remain alert, empathetic, and responsive. I've talked about that, I think, in depth. And then we need to put in place structures that support businesses, because there can be no work without our enterprises. So every one of us, every other day, we contribute to the survival of our enterprises. The question we should ask ourselves is, in which way or to what extent? Are we contributing to the positive or to the negative? To a great extent, to a small extent, or not at all? Then we need to consider the interventions that we need to put in place for the vulnerable. We have vulnerable people within our enterprises. We have probably people with underlying conditions, people who are a bit aged. So what interventions can we put in place for those special groups or vulnerable groups to ensure that they do not lose out, or they are not, we are not putting them at risk because of the kind of, the way we are handling the pandemic as an institution. And then we need to develop appropriate leadership and management styles. And this becomes very key. We've seen that really leadership and management will play a big role in how well we handle this pandemic globally, nationally, and even at our enterprise level. What kind of management styles do we have? What kind of leaders do we have? Are they leaders who are connected or disconnected? Are they leaders who care about the business or they just do not care? Are they leaders who are futuristic, who are vision-oriented, or they are leaders who are, they live for the moment? That becomes very important. And for us, even as people managers, then it pushes us back to think about the people development plans that we have. Where are we investing in terms of really what capacities we need for such a time? So really it becomes a all connected matrix that we have to look at things really from a very broad perspective and not assume that COVID-19 is this one thing that we will focus on. And then, of course, really the need to embrace social dialogue at the workplace. Let's discuss. If we have challenges, if we have unions, let's engage them. Let's have them on a table and talk about the challenges that we are going through in our businesses, as opposed to leaving it to chance. And then the one thing we cannot overemphasize is communication. And that's why you're saying communicate, communicate, communicate. And that means it's really communicate until you sound like a broken record. You better overdo it than underdoing it. You're better off making sure that at least you're in constant touch with your staff, with your suppliers, with really everyone who's connected to your business, to the extent that you know exactly what's going on. Even know the plans that your suppliers or the people that you supply your goods to have. So really, let's build more channels of communication. What platforms work for you? What models or what techniques work for you in terms of communication? And really just overemphasize that and do more of it than less of it. Thank you. I'm happy at this point. I'd like to give a chance to my colleague, Moses, who will then help us look at the next few slides. And then we'll pick it up from there. Moses?
Thank you, Madam Grace. That indeed was a powerful one, a powerful presentation. And I can see from a lot of questions coming up, the members are appreciating, and we'll be able to deal with more of those questions to connect with your excellent presentation. So without much ado, I would want to invite the participants to have a look at really the pictorial presentation that is before you. And to bring this into perspective, I would want us to think about the roles and responsibility of the lady you are seeing in the picture, who represents the human resource practitioner. And I would want to talk about 5 areas that are important for a human practitioner, a human resource practitioner, under the subsisting scenario where COVID-19 comes. And then you ask yourself, actually this goes into the first concern. Did COVID-19 come in as a disruptor or a facilitator for the execution of your human resource and organizational strategy? Many of us will agree that actually it came in as a disruptor. And therefore it requires you as an HR practitioner to look into both the bad side and the good side of COVID-19. It is important to note here that sectorially, there are some industries that were affected, and there are some that were never affected at all by the pandemic. If anything, the government classified them as essential services. But let us deal with the ones whose businesses were disrupted. That means even the execution of your HR strategy was disrupted, so that you have to review, as you go even to review the performance of your staff at the organizational level, at the operations level, and at the individual level. Then you really need to look at how COVID contributed to this, the execution of these roles by the employee. The second thing you need to look at is what are the wage bills that come with the continued execution of your HR plans when we are talking about a situation where you are confronted with an employment contract, you are confronted with a CBA that you feel you cannot sustain. I know for a long time in this country, we have had a situation where many people are asking like, okay, can we really review these contracts back downward? And why would you not be reviewing them downward? Because as we talk today, the situation where the employers and employees are caught up in is how then do you keep the ship afloat? What we call in another language, business continuity. And as a result of business continuity, how then do you save jobs? So then the HR comes in to communicate the impact, what impact has COVID had on the turnover of the organization. Do you feel that as a result of the negative impact of COVID-19, you are left in a situation that you cannot manage the subsisting wage bill so that you need to review some contracts? And it is no secret. Across the industry, we have seen reviews of wages in terms of pay cuts. We have seen a situation where employees are sent on unpaid leave. And this has been made possible through the changes in the business model, where the employers are now saying, for us to survive, we need now to go in and deal with what matters in our business, so that you look at your core business and you see what you can then deal with even through outsourcing. And that has been done across the board. But now, as you review your manning level to see the superfluous manpower and to see how you can cut on the cost and all that, what are you supposed to do? In industrial relations balance, you are then expected to engage in a very simple exercise, which sometimes we ignore and we pay a price. You are supposed to consult, and I'm happy my sister Grace spoke about this. Consultation is key, and that is the time that the HR has to come and share with the employees the status of affairs of the business so that the employees can appreciate where the business is coming from. But what are the two important issues that this HR manager will be putting on the table as agenda? Look, I want to ensure business continuity. And look, I want to save jobs, and I need the cooperation of both the employees and the management. And that is how many organizations have run through these difficult times. But then how do you do this consultative process? There are so many instruments that have helped that many people have ignored for a long time. The very first instruments that all of us have, we talk about the Employment Act. If you look at the Employment Act at Section 10, subsection 5, it provides that when you want to vary contracts that you feel are going to help you review your wage bill to a level that the organization can sustain, then you need to consult. And after consulting, then you reduce the consultation in writing and communicate to the affected employees, but with very explicit terms. Those details I would not want to go into, because we are covering this tomorrow. I'll be with you again tomorrow when we are looking at now the CBAs. And that also includes certain clauses in the CBA, financial nature or otherwise, that the employer may feel they need to review. It requires consultation. And how you communicate your consultation matters most. Where there is organized labor, I'm talking about the trade unions, you would then require to involve them so that it is not seen as something that you are doing as an employer outside the consultative process. Now, let's then also embrace the Industrial Relations Charter. It has also provided for consultation in so many, many aspects, so that when you want to make changes affecting your business, like you have seen what has happened, when the curfews came, you have to change the shift work. Some people have to work from home, some have to work from within your premises. It is a requirement that you consult and reduce this consultation in writing. That will then reduce the level of resistance that you will then have from employees who are not appreciating what you are doing to save the business. Now, allow me to turn to this gentleman, the handsome gentleman that you are seeing here, the shop floor official. I would like you to call him a shop steward. And what role the shop steward will be playing under the circumstances are well cut out. It's the role of a shop floor official at the workplace, in the sense that he will now be taking the key lead as a champion of social dialogue. And when we talk about social dialogue at the workplace, to manage the scenario where we are today, we are talking about 3 key roles that the shop floor officials will be playing. And they are captured under the 3 tenets of social dialogue. The first role will be to facilitate consultation. Remember, the shop steward is the link between the management and the union. And this consultation is very important, so that the shop floor officials, I'm talking about the shop steward, could be communicating to the larger employees the situation as it is, having consulted with the management that, look, this is the situation where we are. We are either performing well as a business or our turnover is going down. And what do we do as a company? What do we do as a family to sustain this business? And the other important role, apart from consultation, is then negotiation. Negotiations have taken a lot of structures. The first one being, what are we negotiating? Are we negotiating for a pay cut? Are we negotiating for sustenance of employment? Are we negotiating for unpaid leave? Are we negotiating for an advance leave? But at the back of the mind of the union and the management, they're saying, we want to save jobs and we also want the business to remain afloat. So then that is done through exchange of information. And what the HR practitioner needs to do now as a management, you need them to be open to the workers and share the business circumstances as it is. If you're doing well, let them know that the business is not doing well. If you are doing, if you have reduced this in writing, let both parties know their responsibility under those agreements. And this is what we call the memorandum of understanding, what we can also call the framework, or we can also call it the impact agreements that we have at the workplace to manage the crisis. They usually come during the execution of a CBA or employment contract as a result of the disruption that we are now seeing in most businesses. So you find that shop steward has a lot and a very important role to play through 1, exchange of information, 2, consultation, and 3, negotiation. So they become a link between the management and the employees to manage the transition well. And then the third pictorial that you are seeing now talks about now the tripartite social partners. And I'll not belabor this. We are all aware that the tripartite social partners, led by our principals, that is the leadership of FK, Kotu Kenya, and the Ministry of Labor and Social Protection, came up with a framework that was then reduced in a memorandum of understanding, as we call it here. And other organizations call it memorandum of agreement. But I would call it the impact agreement, because they came to address an impact, the impact of COVID-19 on businesses. And if you look at this tripartite social partners MOU, you can summarize it in actually 2. What was it addressing? How can the unions and the employers and the government deliberate and come up with a formula of 1, ensuring that businesses survive, what we now call business continuity. And as a result of that, save jobs. So this is what now will be becoming a greater part of your role as an HR, as a shop floor, at the shop floor level, and at the tripartite level. And at this point, I would then like also to pose a question that you can ponder over as we go to the next slide. Who then initiates the social dialogue under the new normal? I would want you to answer that But let us go and have a look at this case study first. You will deal with that during the Q&A session. So the instructions we are going to give are very simple. I would want to give you 5 minutes to go through this short case study. And then after 5 minutes, we will go then to the next slide and address specific questions that will test your appreciation of the issues that come out of this case study. So here we go. I would want to read together with you so that we move faster. The case study is about managing non-compliance with COVID-19 safety measures. With the third wave of COVID-19, we are now seeing outbreaks of virus in a wide range of work settings. The following case study demonstrates how easily a single case can result in further infections, suspect cases, and what can be done to manage such outbreaks. Then let's look at the background. A small technology company based in Nairobi City Center had started to phase out employees back into the office when the lockout was lifted. They have comprehensive COVID response plan, risk assessment, and carried out induction a few days before individuals returned to the office. This covered everyone's obligations and responsibilities. Every employee had signed off on this training and had also completed a return to work form. There is a lead worker representative in place, but that person was not always on site and has limited ability to monitor in person. Confirmed case. On the week in question, the employee in question worked in the office from Monday to Thursday and from home on a Friday. On the following Sunday, he was contacted by a healthcare facility to notify him that he had been identified as a close contact of a confirmed case. The employee called the employer on Monday morning to say he was not going to attend work and explained why. He was tested on that day. He received a call from the health facility on Tuesday indicating a positive COVID-19 test and informed the employer. While no close contacts were recorded, it was reported that the employee in question and two of his colleagues were not practicing social distancing. Keyboards had been shared, they were sitting too close together, and they were going out for lunch, coffee, together, etc. They appeared to have little regard for the information that had been provided in the training course or the safe systems of work that had been set up. Let's look at close contacts. The two employees were already aware that their colleague was a confirmed case and did not attend work on Wednesday. Both were tested. The results were returned on Thursday. One employee was positive and the other was negative. The employer reviewed their contact logs, and once again, no contact had been recorded. A decision was made to inform all staff that there were two confirmed cases. Employees were reminded to monitor their symptoms and ensure that they consult with a medical professional if they had concerns. Disciplinary issue. The disciplinary process was considered for lack of adherence to the safety measures that had been applied. When the disciplinary policy was reviewed, it was advised that it should have been more explicit for a health and safety perspective. In addition, neither the COVID-19 response plan or training had referenced that the disciplinary process could be used if the measures were not followed. In the end, it was decided not to invoke the process, but to focus on making the changes to the existing policy to ensure that they were fit for purpose. I think we have moved together. And at this point, I would want us to turn to the next slide. Again, I would want the participants to volunteer. And whatever a participant has picked up, I would want the other participant to avoid, so that at random, one participant could pick question 1, 2, 3, 4 as we go along until we are done. We are talking about some 9 questions. So I'm talking about 9 participants. And the first question goes, how has your company ensured that it is in compliance with the return to work safety protocol? We are going to allow you to go live, and as we engage in this, please. And I'm able to see all of you, so I'll pick each of you, especially those who are avoiding eye contact now. I'm seeing all of you. So I would want to begin with Agnes. Agnes Gidinji, could you just briefly tell us how you would handle question 1 from relating with the case study? Agnes, are you there? Thank you. As Agnes prepares, I'm giving you another option. You can still raise your hands so that you tell us which question you are taking in order of priority. Please proceed. So we have, who has raised their hands? Please feel free to raise your hands. We want to move together.
There are 3 hands up.
Ndorobo, can you talk?
Good morning, everyone.
Good morning. Good morning.
Okay, I'll just point out like 3 or 4 points. On point number 1, on what my organization has done, that is a KenGen. I think it has been, I want to imagine that one of the most prepared organizations and very alert in capping this COVID-19 by observing the protocols. Number 1, KenGen did an overhaul, a reorganization of offices, because before that, initially people, we were almost close to one another, but it did a reorganization to ensure that there was social distancing, just confirming that there is at least a minimum of 1.5 meters distance from one desk to the other, and of course adhering to the space of 9 meters squared per staff. It also invested in sanitizers to all staff, that at least each staff has a bottle of sanitizers that is well refilled every other time that is down. And on most strategic points, especially the entries. Also invested on thermometers in all entry points, and cleaning hand points on all entry points. Other than that, we have regular sensitization of staff through SMS messages to all staff, just to keep reminding them of observing and adhering to the COVID protocols. I think that is good enough for KenGen.
Thank you so much. Thank you so much. Thumbs up for KenGen. And at this point, I would want now to invite Penny. Penny, your hand was up. And I would want you, as you come in, you state the name of your company so that we learn from one another. Thank you. Penny, proceed.
Good morning, everyone. I am from Base Titanium, which is a mine on the Lake Coast. We have been classified as an essential service, and we have managed to put in place a fairly rigorous process, which started with the top management team evaluating all of our policies and processes to come up with policy. In terms of returning to work safely, the first point of call is to ensure people go through an induction if they have been away from site for longer than 2 weeks. So they're re-inducted in our normal induction, but also around COVID protocol. That also includes letting them know when to not attend. So if someone has flu-like symptoms, they are expected to call their manager and not attend work. Then our OHS manager will contact that person directly to determine whether they need to go for a doctor or self-isolate. In terms of self-isolation, we regardless of what the government does, we insist on people self-isolating for 2 weeks. Adequate supervision in the workplace, yes, that's there, and supervisors have accountability for looking at their staff, and if they see anyone that looks not well, for example, we had a case yesterday where someone's temperature, they looked like they were uncomfortable and their temperature was retaken and it was high and they were sent home. And again, that person is under monitoring. We have a case at the moment where people are not, I think people are becoming a little complacent over the last few weeks, and we face the third wave coming. We have just today reissued the protocol around meetings and social distancing, mask wearing, etc. So hopefully that will be rolled down through our daily toolbox talks. Contact.
Thank you.
Sorry. Enough?
Thank you, Penny. That's a very good experience, and I'm hoping the other participants are learning from you. That is Penny, my friend from Base Titanium. Yes, allow us to move to the next participant. That is Judy Kinyanjui. And Judy, kindly deal with question number 3. Is there adequate supervision in your workplace? Is there adequate supervision in your workplace and related to the COVID-19 interventions? Please.
Yeah, thank you. I work for Kenya Tea Packers, best known for finest tea in Kenya, if you like Ketepa. When this pandemic started, we formed what we call a rapid response team to COVID-19 that's made up of management and other staff from various departments. So we have a team who we call the COVID champions. They'll ordinarily just do walkabouts as and when to just check their adherence to the measures we've put in place, proper wearing of the mask, sanitization, and sanitizing of the workplace, ensuring we focus also on fumigation. We have a fumigation schedule. So that team is charged with supervising the adherence to the measures we've put in place. One of the things that happens is that after every 2 hours, there'll be a call that will run across the organization, and it will call for people to wash their hands. So if you're in a meeting, you will stand up and you sanitize. If you are at the production floor, you will go wash your hands. And that you must do after every 2 hours. Of course, you'll find times when maybe people are doing other things, but with this team in place, and then of course there are measures to take if you found that you're not following that. For example, you'll be denied a cup of tea if your mask was lowered during a meeting, and you'll be told you won't get your afternoon tea. Then if you are recorded again, then you'll be in the list of shame of people who didn't adhere to that. Nobody wants to be in that list. Thank you.
Thank you, Judy. I hope I'll not be a victim because I love Ketepa tea, and thank you for being a very good ambassador for Ketepa. So without much ado, let me move to the next one in the line. This is Andrew Oyugi. Andrew, kindly deal with the process in place. What process is in place if the employees fail to observe the physical distance requirements. Oyugi? Oyugi, are you there? Ask to admit.
Yes, I'm there. Are you able to hear me?
Andrew, proceed. You are clear.
Hello.
You are clear.
Okay.
Andrew,
my name is Andrew Yugi. Okay, my name is Andrew Yugi. I work for CHAK, that is Christian Health Association of Kenya. Our organization is has a mix of doctors, nurses, and we also have a conference facility that is a hotel. So we formed what we call a technical working group, that is a COVID technical working group. And this is the team that is responsible to check whether people are keeping social distance within the office. And what we did is we ensured that some of the staff actually work from home, but management team and the key staff actually work, normally come in the office in shifts. Although our office is spacious and we have various offices in the region, that is Machakos, Embu, and Mombasa. So there is enough social distancing in terms of the seating arrangements, because not all staff come to the office at the same time. So mostly some work from home. Thank you.
Thank you. Thank you, Andrew, for sharing. Thank you. I would want to go to the next person. This is Sarah. Sarah, I would want you, I'm trying to manage time. Then that means, Sarah, you will be dealing with the question number 7. Is your disciplinary process and policy fit for the purpose? Does it need updating to cover breaches of health and safety at the workplace? Sarah, over to you.
Thank you. I'm Sarah from West Kenya. In regards to the disciplinary process, we had a few adjustments with the COVID situation, and we've come up with ways to like punish the employees in case they fail to follow the rules, like for wearing masks and whatnot. So we have the verbal warning. We started the verbal warning. There's a form that you fill, and if that is not working, then you won't be allowed to come to work. If you're not able to follow the rules, you're not allowed to come into work. If that is still not working, you go through now the disciplinary process, because you now seem like you're failing to follow the procedures. So the disciplinary process, you'll be taken through depending on what your issue is, and it is handled accordingly. There's some cases that people are even suspended, and we've not had any cases for someone being dismissed because of that. But so far, that's how we are handling it.
Thank you so much. Thank you so much, Madam Sarah. At this point, delegates, in the interest of time, we are only taking one more question, then we go to the questions that were posted on the question and answer box. So this one, who is going to handle this? This is Geoffrey Nyoro. Mr. Geoffrey Nyoro, kindly tell us how you would process a disciplinary case at the workplace while observing the COVID-19 protocol and guidelines. Proceed, my brother.
All right, can you hear me?
Yes, you're loud and clear.
Well, I wasn't prepared for that, but I'll take it. What I thought I would quickly mention about first, in addition to what my colleagues have said, I work at Rentokil Initio. We're in the essential services sector. So at the height of the pandemic, we were allowed to operate even past curfew hours. We do a lot of disinfection and what guys are calling fumigation. So you can contact us in that line. Okay. The point I would mention is about contact logging system that we have in place and whether we can actually rely on that in the event we have a suspect case. Okay. What we did is that we worked with our IT department and they created a Google-based application that is accessible via phone for every employee, and also that helps us capture two things. One, everyone who enters at our branches, we have around 4 branches in Kenya. And two, a self-assessment COVID-19 application that every employee is expected to capture and answer a few questions on a daily basis. One being where they are working from, 2, any signs and symptoms you may be indicating, 3, temperatures as captured. And of course, like for example, our employees are field-based largely. They would visit customer premises. So temperatures are being taken at client premises. So they would capture in that information. If they have traveled outside Nairobi for 14 days, those kind of exposure questions, analyzing questions. So we have those 2 applications, everyone coming into our premises and also every employee having to be requested to enter that data. So yes, we can rely on that because it captures even contacts of visitors who are not regular employees at the company. So
Thank you, Ms. Sanyora.
Yeah.
Thank you, Ms. Sanyora. That's a very good account. We would have loved to give you more time, but we are running out of time. We will continue engaging. Thank you so much. Allow us now to move to the questions that were posted, which I would want to hand over to Madam Grace.
Okay, thank you very much. So at this point, then we will look at some of the questions, and maybe as we summarize, Moses, when you'll be handling your session, I request you to give at least a general overview for the question that Nyoro left hanging, so that we do not leave that hanging. Yes. So I'll respond to a question that was posted by Penny. And Penny was asking about the issues of the vaccine. And so she was asking around really the issue of funding for vaccines, whether the employer is supposed to, to partially contribute to the to funding, for the vaccines, and then whether there are legal stances on making, staff take the vaccine. So this is what I will say. The vaccine is we're still in the initial stages, even just given the guidelines that have been provided by the Ministry of Health. And what we've been advised so far is that it will really move in a very progressive manner, starting really with the populations, or rather the people who are considered a priority, majorly the ones kind of in the first line in terms of really the COVID-19. These so far have been classified as 1, the healthcare workers; 2, we have the teachers; 3, we have the clergy; we also have the armed forces and people in security. Those are the people that have been given the first priority. And at least from my understanding so far, those particular groups are, the vaccines are not being charged. So this is where we are. We are still in that phase right now. And those are the ones that the government has said really need to then be treated as a priority. So for all our companies where your company falls in any of those sectors, there are facilities that have been mapped up, or there's an organized system in which through which the vaccines are being administered. And that then you could be able to contact. I've seen them going to some of the workplaces, and some of them have set up their centers where people are going for vaccines. All that is needed is some form of identification. That is already in place. As we get to the next phases, I believe the vaccine will start becoming more available to the public. Now, as to whether employers should contribute to the payment for these vaccines or not, I believe this will be more of really a company policy or a company guideline. The same way, for example, we have right now, most of the COVID tests are not being, they are really being charged, and even most of the insurance companies are not taking care of the cost for the test itself. So what has been happening is really companies have been making administrative decisions around what can we accommodate, what can we not. Do we cost share? Do we take up the full cost? Do we have the employee take up that cost? So we'll see really developments in these areas as we get to the next phase. But I think the decisions that we make as our respective companies have to be around the issue of how then safe we are. We have to ensure that safety and health is not compromised in any way. Moses, would you like to add something there?
No, you have captured it well.
Great. So that is it. So at the moment, really, we are not seeing impositions on the same. And then also, what we need to be aware of as employers also is that yes, the vaccine is there, and even for those who are in the frontline categories that I've talked about, there are certain individuals that have been exempted from taking the vaccines. And so then individual circumstances have to play. There are certain people who probably by the nature of maybe some have underlying conditions. We've been told that people with certain allergies cannot take the vaccine. So it cannot be like, mandatory, because you've got to take the various situations of the respective employees come into play. But the most important thing is we have to sell this message well. We have to let them know why it is important to take the vaccine, and where then these facilities are available, then we have to provide the linkage mechanism for the same. Then the other question I will address is a question that was posed by Bernice. And Bernice was asking about the working from home and indicating that most people are currently delivering over and beyond their official working hours at maximum productivity. And she's asking or wondering, why don't you think we need to reclassify working hours and what the Employment Act says? So at the moment, there have been no revisions in our Employment Act, and the Act provides for the number of hours that employees should work. And then what has happened over time is the provisions of the Act, then people have translated that, and they are stated, within the contracts, within CBAs and all that. And of course, with the rest hours that are to be provided for. So these are current developments that we are seeing. In as far as whether it will lead to a change in the Act itself, maybe not necessarily, but really, again, it goes back to administrative processes. And this is what we are saying. Let's try and deal with as much as we can at an enterprise level, because we just have to make decisions of what works for our people. We do not want them to be working for 12 hours in a day, even if, probably that would mean, they just work for 3-4 hours. So let's make administrative decisions that are taking a human-centered approach. So even if people are working from home, let's set timelines, for example. And we had a session last year, and we were discussing this. So if it's working hours, we say it's working as 8 to 5, let those remain there, working hours. And what happens is that then we should provide for the normal breaks. Even when people are working from home, the health breaks are very important still. So we need to provide for the breaks in between, including the lunch breaks that they have to take every now and then. Let's not be too rigid, not to care for that human person that you're saying is what we are really bothered more about. But let's look at productivity measures. Let's look at how we are measuring their performance. What targets do they have? What are they expected to deliver at X time? And really, if we do that, if we make sure that we are setting those boundaries, because they are very important. We also do not want to break people's families and all that. Then we'll, I think, be headed in the right direction. Thank you. Moses, maybe you can take the other questions.
Thank you. Thank you, Madam Grace, well articulated. For the participants, I would want to take you through 4 questions that have been raised by various participants. The first one came from Caroline Kitwa. And Caroline Kitwa was wondering what FKA would be doing, or rather recommending, for delaying implementation of some clauses in the CBA. I would want to refer Caroline to the tripartite social partners MOU that we signed. COTU Kenya was a signatory, and so was FKA and the Ministry of Labor. And what we said was that, look, when you realize that your business is not performing and you are struggling to implement some financial clauses in your CBA, really nothing stops you from engaging the union and persuading them why you would want some financial clauses to be delayed or suspended for that matter. And how many employers have approached this is very simple. You build a business case where the employers have not got it right, and even the unions, is when both parties are not opening up. You need to build a business case and let the union be persuaded that, look, if we implement a clause like the general wage increase, the commute allowance, the increase in housing allowances, it is likely to lead to loss of employment. So we need to make a sacrifice and look at the bigger picture. The MOU is looking at two items in the bigger picture. That is, how do you ensure business continuity? And how do you then save jobs? So when the cost of doing business is escalating as a result of the ballooning wage bill, nothing stops you from consulting, but after you have consulted, then you have to reduce it in writing. That one will not be in contravention of the CBA once parties have agreed, and the agreement has come as a result of a consultation. Now, let me turn to another question that was raised by Andrew Oyugi. How can supervision be done where many employees are working from home? And my take in this, again, would be that, of course, you cannot deploy one of your own to physically supervise how this employee is executing your work while working remotely or from home for that matter. But the best approach to this would be that you assign specific times, specific tasks with key deliverables that this employee is supposed to give the organization with deadline. And once you are right on the deadline and the deliverables, then the employee is expected to supervise themselves and deliver that which you are expecting them to deliver to you, so that you don't have to be physically monitoring them as they work from home. And then the other question comes from my friend, Madam Penny Warren. Penny is wondering if there is a voluntary early retirement in Kenya. Yes, there is. There is a provision for voluntary early retirement, and this has been practiced in so many cases. In most of the cases, this has been practiced to mitigate the painful impact of redundancies. When redundancies come, many employers opt, first of all, to give employees who have reached, let me say, 50 and above, an opportunity to opt for early retirement. In most cases, the employer remains in control of who goes and who does not go. What most employers have grappled with here is when some of your employees holding key positions that you would not have wished to let go are the ones standing up and telling you, I want to take early retirement. In your deliberations, in your consultations, you need to make it clear, very clear to them, that yes, they can opt in writing to go for early retirement, but you as an employer reserve the right to decide who goes and who does not go, so that they don't get offended and they do not feel that they are being discriminated. So this has been a practice, Penny, for a very long time in this country, and it has been used very effectively to mitigate, again, I repeat, the negative impact of redundancies. You know, when redundancies come, they can be painful, they can be costly, and they can also lead to loss of morale among employees. So when others are volunteering to go as a result of voluntary early retirement package, it is more encouraging. Thank you so much. That is all I have to share with you for now. So over to you, Eric.
Thank you very much, Grace and Moses, for very, very insightful and educative session we have had this morning. Delegates, you'll agree with me, it's really been useful, and you have equally contributed to the success of this class today. In summary, of course, we'd like to also thank our Executive Director, Madam Jacqueline Mugo, who opened for us and gave a bit of the recap of what we did yesterday and put in context what we have done today. A few issues have arisen, and one of them is the issue of employee coverage when working remotely or working from home. Issues of health, personal privacy rights, legal issues, and performance issues. These are issues that are all new. We are all grappling with them, and therefore this is an area of concern. And we have picked this up as something that the Federation will want to ventilate more in discussions with you so that we craft a way forward. Another issue that has arisen is the issue of management of COVID-19 protocols at the workplace. Lots of companies have put this in place, and we've had very good case studies from Ketepa, from Rentokil, et cetera, and Kengen, who spoke and shared with us how they put, or what kind of protocols and guidelines they put in place. But the issue arises of how do you manage this? And in the case of non-compliance, therefore, what happens? So does it become a disciplinary issue, or what happens in that case? So this is an evolving situation which needs to be looked at carefully. And a lot of you, a few questions are also emanating from CBAs and variation of clauses within the CBAs. Yesterday we talked about variation of contracts. How do you vary contract? How do you manage contracts in this kind of situation moving forward? Tomorrow we shall be looking at significant trends in CBA negotiations. And I believe, and again, we'll have my good friend and Moses Ombok will be handling this. He's very experienced in matters CBA. So the questions around CBA negotiations, as variation of clauses and so on, will adequately be handled tomorrow. But we are getting this as a key hot area that we need to ventilate on as a federation. Now with that, delegates, we are happy to come to the end of today's session. We want to thank you all. Today we had about 142 delegates attending, quite a high number again. Thank you very much. We shall send you the link for tomorrow before close of business. And I'm happy to report that most of you managed to register in good time for module 2. Keep it up so that you don't do last minute. A few of you have asked about the recordings. As is our practice, we shall send the recordings at the end of module 3. That is tomorrow, latest Friday. So you'll get the recordings. A number of you have also asked about IHRM CPD points, and I'm happy to announce that yes, you will earn CPD points for those who complete the 3 modules. So that is in place, and there are mechanisms we have worked out with the IHRM. You'll be entitled to earn the CPD points. So with that, ladies and gentlemen, I once again want to thank you all for attending and participating. And again, great thanks to my team here, starting with the CEO, Madam Jacqueline Mugo, Grace Kaome, our expert in HR, Moses Ombok, a leading voice in industrial relations. And of course, behind the scenes, we also have a team of IT who have done a fantastic job. In spite of the small hitch we had, they were able to resolve the issue immediately. Thank you very much, and we hope to see you tomorrow at the same time.
Tunasema